This is In Your Right Mind with Dr. Tonmoy Sharma. I'm Bree Chilton, and we're here with Dr. Cervantes.
So, we want to talk about depression and its treatment. So let's start off with the non-pharmacological treatments. We need to do them justice, and they are effective and
Yes.
and used often in conjunction with pharmacology. But sometimes people may not want to take medication. So there is still hope for them, and we have other methods of treatment. Can you tell us what they are?
Yes. So the one that's in the forefront of my mind, that's most common, is transcranial magnetic stimulation, also known as TMS. And basically, earlier I was referring to how the brain uses both electricity and chemicals to communicate. And the interesting thing about that is that if you place, so electroshock therapy, electroconvulsive therapy, excuse me, is a way of getting electricity directly to that brain and rebooting or getting the computer back online. Transcranial magnetic stimulation, instead of using electricity, uses a magnet. And the reason why that's brilliant in many ways is because you don't need an anesthesiologist. You can be awake and alert. You don't need someone to drive you or pick you up from the visit. And since you're awake during the session, then there is a sense of a little bit more control. You could even watch Netflix while you're, in the chair. And the way it works is, the very basics of it is that the magnet transmits this magnetic field through the skull and into part of the brain called the dorsal lateral prefrontal cortex. And when you have depression, that part of the brain is on functional brain imaging is quite dim. In other words, it's black. There's very little activity compared to someone who has normal brain activity. It's lit up and, so with the TMS treatment, over the course of the 6 weeks that you get treatment, then that they do the functional brain imaging comparisons before and after you started the treatment, and you look much more like it's more active.
Right.
And so how does it generate that activity? It's because magnetism gets converted into electricity.
Like your personality.
Oh, you're so charming. So because that magnet can stimulate electrical activity in your brain, then there's no need for all of these other things that need to be done to actually cause ECT and electric changes to the brain.
How long is the session?
So, more recently they've developed something called the theta burst, and the theta burst can last 3 to 5 minutes. So if the patient can tolerate the theta burst treatment, then you're in and out pretty much. You sit in the chair. It probably takes longer to set up the plate where it needs to be and get all the measurements in the chair just right so that you can sit comfortably.
During that time, can they watch Netflix?
Yes.
I can't afford a subscription. Maybe I'll come to your clinic to watch Netflix.
You can catch up on Breaking Bad or something.
Yeah.
The normal or common amount of time for a TMS treatment is anywhere from 18 to 25 minutes.
Okay. And how many times do they need to come back?
And you should come in 5 days a week. However, for some reason, someone needs to miss a day for whatever reason, then that's okay. It doesn't, you don't need to restart or anything like that. But it's highly advisable. It's 5 days a week and for 6 weeks.
Right. Sounds like my mother. She gives me breaks during the weekend. Otherwise, what are you doing?
It seems relatively sustainable, though.
Yes. It is.
And better than medication.
Right.
Well,
we'll get into medication. I think you've got a good point there. Let's do justice to the talking therapies.
So real quick to your point about better than medication, TMS is an 80% improvement in depression rate, whereas sometimes antidepressants have a lot less than that.
Yeah, 50
Or don't
one
work
in
at
two.
all.
Yeah,
Yeah.
sometimes they don't work, which is true. And I think Dr. Cervantes may have mentioned this. TMS is, most of the time these treatments are indicated for treatment-resistant depression. When you have got it might change, but when you haven't responded to 2 or more antidepressants. But let's talk about CBT.
Yeah. No, that's a great point. And that's a perfect segue because in order to have the insurance cover or approve TMS, you need to have tried at least 2, sometimes 3 antidepressants and at least 6 weeks of therapy.
Let's forget what insurance does. We have 123
That sounds
countries that download
True.
this. So they're not so
That's a
bothered
good
about
point.
what the U.S.
That's a good-
insurance does or doesn't do. But from the FDA perspective, at least in
Sure.
terms of what the scientists and the doctors have thought
Right.
was appropriate, you need to have a failure of treatment, so to speak. It could
Correct.
be 2 antidepressants, 3 antidepressants.
And that includes therapy. And so moving on to therapy, there is different kinds of individual therapy styles. The most common one is cognitive behavioral therapy these days. But dialectical behavioral therapy has been growing in popularity, as well as things like mindfulness. And so there's a lot to be said about going and sitting across from another person, or doing it from home. It's very convenient nowadays. You can do a telehealth visit with a therapist via Zoom.
Right. And the skeptical group would say, why don't I talk to my mother or my friend instead?
Correct. So yes, you do get that interpersonal connection. But the thing is that our family members or our friends are not necessarily going to be trained in the proper techniques and approaches that help us come to a reasonable place where we might have a shift in perspective, or
Right.
And
where
they have their own biases.
well,
or
yeah, exactly, exactly, and that's the problem that family and friends will often, they mean well, but sometimes they will just tell you things that are not helpful at all.
And they might be the cause of your
Exactly.
you never know. It's from the frying pan into the fire.
Yes.
So there is some evidence. I think it was published in Biological Psychiatry maybe almost 5 years ago or more, where you had functional magnetic resonance imaging, which you mentioned earlier for TMS, where they measure the blood flow, and which is a surrogate for neuronal activity in the brain.
Right.
So functional MRI showed that after 6 weeks of CBT, there was changes in the pattern of blood flow, very similar to antidepressants, and perhaps the effect was more than antidepressants at that point. So it's not just about you talking to somebody. There are changes in brain function,
Right.
with cognitive behavior therapy, and properly administered, not by friends and family, but
Right.
by somebody who's licensed and trained. And I guess dialectical, behavior therapy is more used for some of the other conditions, which we can come back to. But I wanted to finish off with the antidepressants and see what we can talk about on this show. I know we talked about serotonin and what was not there.
Right.
So very quickly about antidepressants, what in your clinical practice, what do you do?
Okay. And that's an excellent question, because a lot of times people start an antidepressant and they have certain side effects on that antidepressant, and they get very discouraged because they think all antidepressants are going to cause this side effect. I cannot take an antidepressant. And that could be anything from, I'll give you a list, specifically with serotonin reuptake inhibitors, the most common side effects are dizziness and nausea. And the one that a lot of people complain about is that if you're depressed, you already have a low libido. But whatever libido you have left, if you do engage in sexual activity, it's very difficult to achieve orgasm because of this condition called anorgasmia that people get when they're on a serotonin reuptake inhibitor. So what a lot of people don't know...
One could go on for ages. Is that what you're saying?
The side effect?
No, the activity.
It's funny.
If I were selling antidepressants, I would just mark that as the as the main selling point. I mean, who cares about mood when you can just carry on? You have so many happy people on both sides.
I love that you said that, because one of the uses of serotonin reuptake inhibitors is for a condition where males achieve orgasm too quickly. And if they give them a serotonin reuptake inhibitor, it actually does help them.
See, I wasn't that wrong. So treatment for premature ejaculation.
Yes, exactly.
If that is the case. We have a little bit of time, so let us end with the psilocybin story that came out yesterday on CNN.
Okay. Do you want to?
Yeah, I was wondering what your perspective is. I think our audience would like to know what the story is.
So the story basically was that they administered 3 different doses of
LSD.
Of LSD, yes, to different groups in different countries. So it was Canada, it was the United Kingdom, and I believe it was the United States. And it was like 10 milligrams, 15 and 25.
Okay, whatever the dose was.
And basically they determined one session improved depression a significant amount, but it basically waned or disappeared, or the effect within three months was gone in a lot of people. So that suggests that if we do end up doing psilocybin treatment, then it would have to be perhaps repeated every 3 months. And the other important thing is they did also receive, I believe it was 2 sessions of psychotherapy.
Right.
Along with that. So it is a promising research study.
Right. So we must remind our audience that psilocybin this is manufactured psilocybin and not sort of street LSD.
Right.
And that this is a study and not licensed by the FDA. So it's early days. And we do have ketamine, though, that is licensed by the or that has got an FDA license for administration. Just 30 seconds.
So basically, there are different ways to receive ketamine. You can do sublingual lozenges. The problem with that is that it's less bioavailable, meaning that your body doesn't absorb it as readily. You can do intramuscular, so a shot into the muscle, or you can have IV ketamine, where you go to an infusion center, you sit in a chair and you wait, and they put an IV in your arm. Usually that requires 2 to 3 visits a week, and it's about 6 weeks. And there has been a significant improvement in patients who have treatment-resistant depression, which means nothing else worked. And this is working, and things like suicidal thoughts are going away, and people are, able to function again, start going to work again, all of the things that are disabling. So.
Okay, good. Who would have thought a horse anesthetic would become a treatment for depression? But then, the world is changing.
Yes.
Thank you very much for being on our show.
Thank you.
It's always enlightening to have you here.
Thank you. I love being here.
Thank you for joining us. This is In Your Right Mind with Dr. Tonmoy Sharma. I'm Bree Chilton, and thank you to our guest, Dr. Cervantes.
Thank you.